Hello, I'm Al Ali, and I'm very excited that you're going to have surgery done with us. And I really would encourage you to spend some time looking at these videos because they're extremely helpful to your recovery. It's an exciting time for you, and we're excited, and we're here to help you. And I think these videos will help get you there. What we're going to talk about now is what your experience will be like around your arm reduction or brachioplasty surgery. It's normal to be nervous anytime you have surgery, so don't be concerned. You wouldn't be normal if you didn't have some level of nervousness, so it's okay. I'll first start out by telling you that we will give you a set of prescriptions, and I write them on the day that you come in for your preoperative visit, and they will go to the pharmacy that's on your medical records. And I would really prefer that you pick them up before you come to surgery. So on the day that we see you, please pick them up, because after surgery, it's very uncomfortable and inconvenient for you as you're driving home to pick them up, or your loved ones picking them up for you. So it's best to just get them up front. So please do that. I will mark you in clinic 1 or 2 days prior to surgery, and that can take anywhere from 30 to 45 minutes. I use those markings to plan surgery and as well as use them in surgery. So we photograph them after we mark you. So expect that. It's very important to us. The day of surgery, I will see you before surgery. I will say hello. I'll check your markings. I'll give you an opportunity to answer any questions that you still may have. After that, the nursing staff will get you ready for surgery. Anesthesia will come in. They will say hello. They will also have you sign a consent for their part of the surgery. And then one of my residents or trainees will come in and have you sign a separate consent, separate from the one that you sign in clinic. After that, you'll be taken to the operating room. Most people don't remember much after that because the drugs that the anesthesiologists give you kind of make you forget about what happened. And the first thing you'll remember is you'll wake up in the recovery room. Most people are still pretty groggy when they wake up, so you may not remember a lot of it, but you may remember some of it. You'll notice that your arms are going to be on a couple of pillows on each side, and that's what we'll talk about in a little bit later about how to keep your arms after surgery. Recovery usually takes a couple of hours. Some people wake up a little bit quicker, some people wake up a little bit slower, but the nurses have criteria to send you home, and when those criteria are reached, then they can go ahead and send you home. But before then, they'll keep you there. It's very unusual, unless you're having the arm surgery done with other surgeries, to have a catheter in your bladder. That catheter is put in while you're asleep. If you've had something much bigger, like an upper body lift, the catheter will probably stay in at least till the evening, or if not, the next morning. But if you're going home, you most likely will not have a catheter in your bladder, so you don't have to worry about that. Everything that we operate on, or every area that we operate on, we inject with a local anesthetic that lasts from 48 to 72 hours. And I'm going to discuss that a little bit later when we talk about your prescriptions, but that medicine we give you in the operating room, and it's really our main mode of reducing your pain. Since we started using this medication, it's really changed the nature of surgery for us. Patients are just much more comfortable. Hopefully, you're going to have a typical experience with this medication that we inject and have enough reduced pain that it's really quite tolerable and makes it a much more pleasant experience than before we started using this medication. The diet that you'll have after surgery, especially if you've only had arm surgery, you're going to go home, and the nurses will start you on ice chips. Sometimes people advance a little bit quicker. Sometimes if they're still not feeling too good, that's about probably where you get to by the time you go home. But when you go home, we would prefer that you don't eat anything major in nature. So we'd like you to eat jellos, soups, very light pastas. Remember, it's always better to throw up those things than pizza or steak. So for 24 hours, please don't eat anything major, very light foods. And then after that, you can advance your diet appropriately. Your incisions will be covered by glue, and we don't use any external stitches. That glue will cover the incision. The only thing external will have is a few metal clips in the armpit. The reason we put those few metal clips on, which we take out a couple weeks later, is that's the area that's most likely to open up after surgery, and we want to protect it for those couple weeks. Your arms, as I said, will have glue on them, but you may leak some fluid for about 72 hours. Don't be concerned about that. Just make sure that, if you're putting your arms on pillows, that you protect the pillows, and you don't want to ruin any nice material that you put on those. We don't use drains on this surgery or any other surgery, but we use internal suturing, so we don't have to use drains. And as we'll talk about when we talk about the prescriptions, we also give you something to reduce fluid so you don't accumulate fluid in the areas that we operate on. It's very important that you get up and walk when you get home once you're awake and alert completely. The worst possible complication after this surgery is blood clots that can start in your calves, and then they can migrate into your lungs, and that's life-threatening. So the best way we know how to reduce that is to get up and walk. So the night of surgery, you have to do that at least once. Now, if you feel great, get up and walk a lot more, but at least once. The next day after surgery, we expect you to get up a minimum of 6 times, 10 minutes each, and we don't want you in bed. The only time you go to bed is if you're taking a nap or you're going to bed at night. The rest of the time, you're either walking around or you're sitting in a chair. Very, very important from a safety standpoint. What are you going to do with your arms after surgery? As I said, when you wake up, your arms will be on a couple of pillows. What we want you to do is we want you to keep your arms at heart level or slightly above. So your heart is right here. You want to be up to here in neutral position. What does that mean? This is not neutral. This is not neutral, especially this. This will cause a tourniquet effect and you'll get swelling in your hands and your forearm. So neutral is just a natural curve of your elbow, again, above the level of your heart, whatever position you're in. Now, while you're in a chair or while you're in bed, that's easy. You just put in 2 or 3 pillows underneath and you get them up, that's easy. Just don't put the pillows into the armpit because that can block the armpit. So just kind of keep them low here. The difficulty is, what do you do when you're walking around? I tell you, the cheapest way that I learned from a patient is to go to Home Depot, get a couple of sticks and put little rubber stoppers at the bottom, stand up before surgery, mark the level that you need to be at, and then walk around with them. That will keep you there. It's very cheap. It's very easy to do. So I would highly recommend that you do that. Now, you don't have to do that. You can just kind of hold your arm up, but it's a little bit harder to do that. Now, the only exception for this neutral position where you can bend your arms is going to the bathroom or eating. Now, those are not extended periods of time, so you can transiently just move your arms, but the rest of the time they should be up. And we want you to be in that position for a couple weeks. Then when you come back and see me, we'll decide when you can put your arms down and advance to, doing different things. But that's a minimum of about 2 weeks of doing that. If we do a brachioplasty alone, arms alone, I don't usually have you wear any garments. You're just only up here, and that's all it is. Now, if we've done it with something else, like an upper body lift where we do the chest, breast, or the back, we will most likely have you in something like a vest, and that will be immediately after surgery. Sometimes, even if you're just having a brachioplasty or arm reduction alone, we will, at about 2 weeks, I'll maybe have you get in a garment. Sometimes I don't. It just depends on how much swelling you're having after surgery. When you get home the next day, after about 24 hours have passed and you're completely awake and alert, I want you to get in the shower. So you just wet everything with lukewarm water, no hot showers. And then when you're done, pat dry your incisions, and that's all you need to do. Now, I need you to take 1 shower a day for a minimum of 30 days. It's important because it keeps things clean. Also, most people feel more refreshed when they take a shower. So I highly recommend that you do that at least once a day. I don't want you to be in a bath, in a pool, or seawater. I don't want you to immerse in any fluid. That's not acceptable. You can be in water running over you like in the shower, but not immersed in water. That can increase your risk of infection significantly. And you have to ask me in the follow-up visits when you can go into water. All those things are very typical for having surgery done alone, meaning without any other surgeries. Now, there's a few other things that you need to do when you get home. One is you should avoid heavy lifting or strenuous exercise for a minimum of 3 weeks. And there's a basic rule: if something hurts, don't do it. All right, so it's a bad idea to do something that really causes you discomfort. So if raising your arms up way above your head or above your shoulder hurts, don't do it. You can do it gradually. We'll talk about that in clinic when you come in. As a general rule, after surgery, it's better to be up, moving around, doing things, and I expect you to get up, especially after the first day or two, to get up and do most things that you do. You'll find that things above your head or above your shoulders are going to hurt more. Things down here, you can do most things. So not in bed, chair, or walking or doing things. That's going to be the good general rule because, again, we want to prevent that really bad complication of clots that can start in your legs going to your lungs. As far as driving goes, the risks that you have with driving are not so much related to the surgery, they're related to safety of driving. So you won't injure your arms driving, but if you cannot perform emergency maneuvers in an emergent fashion, meaning turn the wheel really quickly because your arm hurts, then you can get into an accident. So your guide as to when you can drive is when you can perform emergency maneuvers without hurting. And that varies depending on the individual. Sometimes it's a couple weeks, sometimes it's 3 to 4 weeks. I can't give you that exactly because it depends on your body and how you're tolerating things. Pain medications other than the injectable material that we use in the OR. First, we use high-dose Tylenol. Second, we use gabapentin, which is a direct nerve pain reliever. And then the one before last is we use Celebrex. Celebrex is very much like Motrin, but it's a longer lasting medication. And I know some bariatric surgeons don't like you to be on that drug or that class of drugs, but we've had some pretty good success as long as it's a short period of time while you're recovering from surgery. The last medication that is a non-narcotic is a steroid that we use. Now, this steroid is a pack of 6 days of steroids. You start out with 6 pills, then the next day it's 5, 4, 3, 2, so you decrease each day. The way steroids work is they reduce inflammation and they also reduce swelling, which is an indirect painkiller. So we would like you to take that. All 4 of these work on different mechanisms. So you could take them all together or you could take 1 or 2, but except for the steroids, I'd like you to take that all the time. The other 3 you can alternate or not use them or use them as needed. We also give you something called Colace, which is a stool softener. It'll help you. Now, if you do anything else that helps you move your bowels, please do that. Whether it's drinking coffee, certain foods that really get you going, but we really want you to have a bowel movement as early as possible. Other medication that we use is related to the fact that we don't use drains on anything that we do. It's a very mild diuretic and it's called hydrochlorothiazide. The short term is HCTZ. It's a very low dose of this medication and it gets rid of fluid from your body. A lot of the pharmacies will ask you if you have hypertension because it's usually used for high blood pressure. It's not being used for that in this particular situation. It's just to reduce fluid from your body. People tell you to drink a lot, very large amounts of fluid after surgery. We really don't want you to do that because what happens after surgery is all that fluid will go into the area that we operated on. It can cause fluid collections, which are called seromas. So we want you to drink, stay hydrated, but only enough so your mouth is not dry. And this medication will be the one that you'll be using the longest. It's for 30 days after surgery. The last medication that we will give you is something that helps you reduce nausea. It's called Zofran, and you only take it if you're having trouble with nausea. Again, all of these things are going to be at the pharmacy, and please pick them up as soon as you can prior to surgery. The patient information sheet, which you probably already have, we will give you again in the preoperative period, and it really has pretty much all the information that's included here in this video, but we just want you to have it in written form. You can refer to it, and it's a very good source of information for you. If there are questions that are not answered, please don't hesitate to contact our office.